Hi there, my name is Dr. Nicole Siegfried and I'm a licensed clinical psychologist, and I hope you find this video helpful.
Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after experiencing or witnessing a scary or shocking event or series of events. The causes of PTSD can widely vary and may include military combat, natural disasters, physical or sexual assault, a serious accident, childhood trauma, medical trauma, witnessing trauma, terrorism, prolonged or chronic stress, or sudden loss. PTSD is surprisingly common, affecting about 6 of every 100 people at some point in their life. PTSD is more common in women and combat veterans. It's important to note that not everyone who experiences these events will develop PTSD. If you've been through something traumatic, it's natural to have some emotional and physical reactions in the aftermath. However, if these reactions are severe and long-lasting, interfering with your daily life, you may be experiencing a PTSD episode. It's important to remember that you're not alone in this, and there are effective treatments available for PTSD, including therapy. PTSD episodes can be very distressing and disruptive, and here are 9 signs and symptoms of a PTSD episode. First is flashbacks, which are intense, vivid memories of the traumatic event that feel like they're happening again right now. You may experience physical sensations like sweating, rapid heartbeat, or trouble breathing. Also, nightmares. Nightmares about the traumatic event are another common symptom. They can be very disturbing and leave you feeling scared and disoriented when you wake up. Also, intrusive thoughts, which are unwanted and disturbing thoughts, images, or worries related to the trauma that can pop into your head unexpectedly. Another symptom can be emotional numbness. Sometimes people with PTSD can feel emotionally numb or detached from others. This can be a way of coping with the overwhelming emotions that can come up after a trauma. While a person with PTSD can turn to emotional numbness, it's not a healthy coping mechanism. Also, hypervigilance. People with PTSD may be constantly on guard, scanning their environment for signs of danger. This can make it hard for them to relax or feel safe. Also, irritability and anger outbursts. It can be common to feel irritable or even explode in anger after a trauma. This can be because you're constantly on edge or easily startled. Another symptom can be trouble sleeping. Flashbacks, nightmares, and hypervigilance can all make it difficult to fall or stay asleep. This lack of sleep can make other symptoms worse. Also, difficulty concentrating. It can be hard to focus on work, school, or even everyday tasks when you're struggling with the emotional and physical effects of PTSD. Also, isolation and withdrawal. You may start to avoid places, people, or situations that remind you of the trauma. This can make it hard for you to maintain relationships and do activities that you used to enjoy. So how long does a PTSD episode last? PTSD episodes can vary from person to person and don't have a set time frame. They can be triggered by something specific, or they may seem to come out of the blue. The good news is that with treatment, PTSD episodes can become less frequent and less severe. Many things can cause or trigger a PTSD episode. Some of the most common triggers can include, first, reminders of the trauma. Seeing, hearing, smelling, or tasting something that reminds you of the traumatic event can trigger an episode. This could be anything from a loud noise or a particular smell. Next is stressful situations. Even everyday stress can trigger a PTSD episode, especially if it makes you feel overwhelmed or out of control. Also, anniversaries can be a trigger. The anniversary of a traumatic event can be a particularly difficult time and can trigger episodes. So how can you cope with PTSD episodes? While a PTSD episode can feel overwhelming, there are steps you can take to manage it and regain control. Here are some strategies that you can practice on your own in addition to seeking professional help. First is grounding techniques, which can help bring you back to the present moment and out of a flashback. An example of this would be engaging your 5 senses. You can focus on your physical surroundings, name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Make sure to really focus on the details of each thing you identify. Another example of a grounding technique would be focus on breathing. Slow, deep breaths can help activate your body's relaxation response. Breathe in through your nose for a 4 count, hold for a count of 7, and slowly exhale through your mouth for a count of 8. You can repeat this for several minutes or until you feel yourself begin to relax. Also, you can practice self-soothing techniques. These methods can help calm your nervous system system and reduce emotional distress. First is progressive muscle relaxation. Tense and relax different muscle groups in your body, one at a time. Start with your toes and slowly work your way up to your head. Focus on the feeling of tension and then release it completely. Next, you could try mindfulness. Practice paying attention to the present moment without judgment. Focus on your breath or the sensations in your body. Mindfulness apps can be super helpful for guided meditations. Also, managing your environment is important. If possible, try to remove yourself from the situation that triggered your episode. Find a quiet, safe space where you can relax and focus on calming yourself down. While there are strategies that can be effective in the moment, therapy is a powerful tool to help you with long-term management of PTSD episodes. At Lightfully Behavioral Health, a therapist can provide you with whole person-centered care and can help you identify triggers, build emotional regulation skills, and develop a support system. In some cases, it may also be beneficial to have medication management used in conjunction with your PTSD therapy. Medication can help manage symptoms like anxiety, depression, and difficulty sleeping, which can happen during PTSD episodes. Overall, it's important to be patient with yourself. Learning to manage your PTSD episodes takes time and practice. If you find yourself struggling to cope on your own and you need further support, our deeply compassionate experts at Lightfully Behavioral Health can help. We understand the unique challenges of PTSD and can work with you to develop a personalized treatment plan tailored to your specific needs and triggers. Each individual's experience with PTSD can differ greatly, making personalized care crucial. Remember, change is possible. When you're ready to take the first step, reach out to our admissions team. We'll take the next steps together towards the fullest, brightest version of you.